Hi, my name is Spike Peringer. I'm a pulmonologist intensivist at the Billings Clinic, and I'm here to talk to you about sepsis at the Billings Clinic and some things that I'm really excited and happy about. The observed expected mortality in sepsis has finally reduced below 1. That means we're better than everybody else doing this. Why is that? Well, let me give you an example. I want to go through a case and tell you who's responsible for making our care for sepsis that important. So this 70-year-old female came in. She came in because she had a fever and was feeling weak. She was seen in the emergency room where the nurse, Sam, and then Monica, observed and realized that she in fact had severe sepsis. They initiated the sepsis plan. Luckily, the IT department is keeping the computer perfectly, and they realized that that patient had also been on Cipro the week before. So George and Ty enabled that to be done perfectly. Fortunately, Lisa had been educating him over the last month on the importance of sepsis and that this was an emergency. Thereafter, Jed, the doctor, came in the room and managed the patient perfectly, gave them early fluids, maintained their blood pressure, and actually put a central line in. The pharmacists, Dan and Phil, Dan in the ER and Phil down in the basement where he probably should be, got the drugs up quickly and the appropriate dosing so this patient had early and appropriate antibiotics. The patient went for a CT scan, and Jason rapidly noticed that they maybe shouldn't get contrast, called Jed, and made it work so that they did the best CT scan without harm for the patient. Fortunately for us, the whole ER was on alert. I'd like to tell you this was just one small group of people that did it, but Nate and Carrie have been educating these people and putting a great plan together so they had early sepsis care down perfectly to the point where they were doing it 90% and greater compliance for their whole bundle, okay? Patients transferred to the ICU. The nurse, luckily, Pat and Anna, the housekeepers, had cleaned this room so that there was no germs present in the room. Likely, this room would have just been bare, but Kimberly and had actually stocked the room as, in fact, she should have. As you'll see in a moment, that's very important. Anna and Joanna, the nurses, brought the patient in the room, realized that the patient was having trouble breathing, and alerted the attending and the respiratory therapist. JB intubated the patient with a glide scope. The glide scope had been donated by somebody who really cared a lot about sepsis and having safe airways. She bought that glide scope for him, and that was Kathy Stevens. Okay. Thereafter, Joyce, the physician, who's very dogged and actually found out that this patient had sepsis and needed to find the source. She looked at that CT and found out that in fact this patient not only had an abdominal problem, but probably an abdominal problem caused by C. difficile. And so she alerted our surgeon, and Laura and Ross, who are the PAs for the surgeon, alerted the OR and got him ready. Gordon, the surgeon, took him to the operating room where Brian almost blew it, but he kind of got everything together and they got the colon out safely. Fortunately for us, the family had arrived, and our pastor, Ramona, and Father John came by and prayed for the patient. That prayer helped that patient get through the surgery and helped them live as well too. Thereafter, the patient started to recover, and PT and OT kicked in. Bryce and Carly were getting that patient up, moving him around, getting him moving, because if they didn't do that, they would have had a secondary pneumonia. Quality team, Lori, Sherry, and Jen, had organized this whole thing so that it was tightly interwoven. Thereafter, coding helped us, as well as case management, Naz and Luann respectively, to help get the patient to the appropriate setting and to appropriately bill. Why is that important? So that we have the facilities to in fact care for these patients. Mitch and Jean had already planned these facilities so that in fact there's a big window and the patient didn't get delirious. Finally, Nurse Davis, a former employee of ours, transported the patient to their car, and they went and visited with their neighbor, Liz, who happens to be a board member. And Liz, the board member, in fact, realizes that quality is so important that she made it a #1 initiative of the board. Finally, the foundation realized this as well, and Penny donated all kinds of money to make sure that we had a new wing. So why did I go through this tale? And it's kind of hodgepodgey. Just to give you a tip of the iceberg, less than 10% of the people that actually help us get our observed to expected mortality, less than 1. Thank you so much.